All right, so let's take a look at the feedback that I get from new grads and students that are going out on their rotations, new grads that are getting into the broken system and getting frustrated really quickly. The three biggest things that you guys complain about and tell me about, and I'm going to tell you at the end of this video how you fix these three things really easily and you get out of the mess before you get into the mess. So, first thing you guys complain about is reproducible results. So what you're getting stuck with is falling into the conventional thought process when it comes to thinking through your evaluation and your treatment and your planning and your patient education, exercise progression, all that stuff. You feel like you're changing your thought process depending on who you're treating. Are they an athlete? Are they a Medicare patient? Are they active? Are they sedentary? Is this chronic? Is this acute? Is this pre-op? Is this post-op? You're constantly changing your thought process because you think that you can't do the same thing with every single patient. So what you need to understand is every single patient that's coming to see you is a human being, and that we all have the same neuromuscular physiology. We all basically move in the same patterns. So if you understand how to evaluate on a functional level to get to the root cause on a neuromuscular functional level, then you can use a reproducible thought process that will get you reproducible results with every patient across the board. So you don't need to change gears and think about, well, this is chronic tendonitis versus acute tendinosis or something like that. So you need to figure out that your thought process has to be the same and it's reproducible with every single patient, which makes your results reproducible, which takes away the confusion. So every time somebody walks in and you're doing an eval, your thought process is the same. You are completely clear on what you are going to do with them before you even see them. So it's not going to be, well, I need to see this patient and listen to what their symptoms are and what they do and what their physician referred before I can start putting my thought process together. Before my patient comes back for me to do an eval, my thought process is already set. I don't change it for anybody. Now, there's going to be little tweaks in there that I'm going to change, but my overall encompassing thought process is reproducible, which is why my results are reproducible. All right, second thing you guys complain about is going from evaluation to treatment. You do all the special tests and all the differential diagnosis and all the stuff that you're supposed to do, listen about their symptoms and all that kind of stuff with the eval, and you gather all that information, and then when it comes time to treat, you feel like you're starting over. This process going from evaluation to treatment should be seamless. This should go directly into your treatment. Your treatment should go directly into a reevaluation, so you're reevaluating function, and that should go directly into your exercise progression and prescription, which is another thing that you guys keep telling me you struggle with. How do I know what exercises go with this? You know what your exercises are because you saw this, you treated this, and that tells you exactly where you're going with your exercise, because even though this process is reproducible, every single patient is going to have different exercises, even if they come in complaining of the same symptoms. Everybody's going to be unique. So this is where you're struggling, because what they taught you in school was to evaluate pain, range of motion, gross strength, stability, swelling. What is all that? Those are all symptoms of the underlying root cause of the problem. So if you're actually getting the information here that you should be getting about root cause of the problem, that's going to take you directly into what you're going to do with your treatment. You don't have to try to struggle with, well, should I do stretching or should I do myofascial release? Should I do cupping or should I do needling? Do they need an orthotic or should I do tape? All of those things that I just mentioned are symptom modification gimmicks. So if you evaluate symptoms, you can only treat symptoms, and this means you have to go digging through that toolbox full of gadgets and gimmicks to cover up symptoms, and at the end of the day, that doesn't tell you what you should be doing for exercise. that doesn't tell you how to educate this patient as to what's going on a physiological level. You're going to have to tell them nocebos and fairy tales and just junk thinking to explain away the symptom modification gimmicks that you just did. So if you're here and you're getting to the root cause, that takes you directly to your treatment, which is the same for every patient, because every patient, just like I said, is coming in for neuromuscular physiological issues. You're getting to the root cause of that for every single patient. And then you get results, and that takes you right to your exercise progression and patient education. So if you feel like you're getting all this information here, you're not sure what that means when you get here, and you're definitely not sure what that means when you get to exercise prescription, that's because you're thinking the way they taught you to think, which doesn't work in the clinic. Remember, if you're thinking the way a PhD taught you to think in school, that doesn't know how to assess, treat, and get to the root cause in the clinic, then you won't know how to do that either. All right, third thing that you guys complain about is either getting out of or avoiding the conventional model, and most specifically PT mills. So how do I get out and get a job where I'm not stuck seeing 3-4 patients an hour, I'm handing off my patients to aides, or I'm doing evals and then I'm handing them off to the ATC or the PTA or the aide to do the treatment. I'm running them through a whole bunch of stuff. My boss tells me that I have to charge for 3 or 4 units. I don't know how to do that and actually treat the root cause, because all of those treatment strategies that I'm charging for are just masking symptoms. My patients aren't getting any long-term functional results. I'm getting burnt out. I'm asking questions of my peers who are in the mill with me, and they're only giving me PT mill answers because that's all they know. So how do you avoid getting into it, or how do you get out of it if you're already in it? How do you avoid getting into it if you're a new grad or you're a student preparing to get out there and get to your first job? So here's how you do that. You change your thought processes. So if you do get stuck in one of these jobs because you get out of school, you got to get a job. Understand this. If you get into a PT mill where you're working with 2, 4, 6 other PTs that have 1 to 5 years experience of being stuck in the mill, and that you look over and you see them doing all the symptom modification gimmicks and that's all they do, you will soon turn in to those people because that's what you're being influenced by, and you're not getting your questions answered. So if you're a student, the way you avoid that is hopefully you've already gone through the student and new grad success guide, which is there for you to watch. It's modules that will get you the thought process, the groundwork that you need to avoid getting into that. And if you do get into that, because that's the only option you have, at least you'll have that in a community of people that think like we do, that can help guide you so you're not getting stuck and eventually turning into the broken medical model PTs. Now, if you're already in there, how do you get out of this situation? Well, you hopefully have already gone through the student and new grad guide. So you've got the base work for it. Now you need to add on to that getting in the shift, because that's where we're going to teach you how to get reproducible results. That's where we're going to teach you how to go from evaluation to treatment to patient education to exercise progression, all in a seamless style, because that's how we think, and that's not how you think because you went to school where they don't teach you how to do that. So if you are struggling with these 3 things that I keep on hearing, new grads and students and even seasoned PTs, we just had a PT go through the shift who's got over 23 years of experience of being frustrated and wanting to get out, but didn't know how to do it until he got in the shift. Now he's out of the system. Now he's opening his own clinic. He's bringing on other therapists that have gone through the membership so they can change the way PT is provided in their area. So when you're ready for that and to get out of this and address all 3 of these issues that you guys keep on bringing up with me, make sure you get in the shift. And we're looking for 3 people to join right now for a lab weekend that will be coming up soon.